Welcome to Healthy Frontiers. My name is Dr. Bizzoni. I'm a chiropractor, and this show is dedicated to the education of our viewers. My special guest today is Dr. Alex Mauskop, and our topic is headaches. Dr. Mauskop is an MD. He's a founder and director of the New York Headache Center, with offices both in White Plains and in Manhattan. He is a professor of clinical neurology at SUNY, Downstate Medical Center. He has conducted and published original research in the field of headaches. He's authored 3 books, many book chapters, and dozens of scientific articles. He serves as a reviewer for medical journals such as New England Journal of Medicine, Neurology, Headache, and others. His research led to the development of an over-the-counter headache medication called Migralex. Dr. Mauskop is known worldwide for his research into complementary and alternative treatments for migraine and other types of headaches. Over 200 doctors from all over the world have visited the New York Headache Center to receive advanced training from Dr. Mauskop. He has given lectures and grand rounds at institutions such as Cornell, Harvard, Columbia, NYU, and Dartmouth medical schools, and the Mayo and Cleveland clinics. He has been an invited speaker at the meetings of the American Academy of Neurology, American Headache Society, and International Headache Society. He is a fellow of the American Academy of Neurology, the American Headache Society, and the New York Academy of Medicine. It's a pleasure to have Doc on my show. Welcome to the show, Dr. Mauskop.
Thanks for having me.
Okay, so I'm going to start off with speaking about headaches. How common are migraines and other types of headaches?
Unfortunately, they're extremely common. People don't realize that about 35 million Americans suffer from migraines, and about 100 million people have tension-type headaches in any particular year. So
yes.
Half of the people in the country suffer from headaches.
That's huge.
Yeah.
Huge. Okay, so how do you know that you have a migraine and not another type of headache, different types, right?
Very common question that people often ask me, how do you know what I have? Because we don't have a test for it. We don't have a blood test or MRI scan to show you have a migraine, you have a tension headache, you have a cluster headache. We rely on description. So migraine is defined as a headache usually that's more severe than a mild tension headache. Mm-hmm. Often, but not always, there is nausea, throbbing sensation in your head, sensitivity to light and noise. That's what makes it a migraine. It's not just a headache. It can be very, very disabling.
Right. Could others be disabling as well, as much as that? Would you say like a tension headache? Or
tension
is this
headache
like
is not. But
class of itself?
You're right. It's class of itself because tension headache by definition is not very disabling. There's one rare type of headache that's worse than migraine. That's called cluster headache.
Okay.
More men are affected by cluster headaches, but fortunately only like 0.1% of the population suffers from cluster headaches, while 12% suffer from migraine.
Okay, so I guess I'm going to just ask you this question. What's the difference between a cluster headache then if it's so severe and a migraine headache which is also severe?
Right, so cluster, the name comes from the fact that it comes once a year on average.
Okay.
For a month or two. 1 month you get a headache every night, wakes you up from sleep, sound sleep, 30 minutes to 2 hours, and then it stops as if nothing happened. But during those 30 minutes to 2 hours, people consider suicide because the pain is so intense. It's always on one side. Very often there is tearing and nasal congestion, and people become very restless. Often misdiagnosed as sinus headache or as migraine, but in fact it's short, happens once a day for a period of time, then goes away. That's why it's called cluster.
Got it. Great answer. Thanks. So, Doc, what causes migraine headaches?
Another common question is my patients ask me, I want to find out what the cause is, take it away. I don't want to take drugs, just, cure me.
Yes.
Unfortunately, half jokingly, I tell them, the cause of your headache is your mother. And they all start laughing. But in fact, it's genetics.
Okay.
It's clearly genetically inherited disorder. So you're not born with migraines, you're born with genetic predisposition. So if you have that genetic predisposition, you're more likely to get migraines. And very often it begins with a mild head injury, or with a bad cold, or just sometimes with puberty in kids.
So triggers.
So trigger brings it on. If you don't have a family history, you're much less likely to get these migraines.
Okay, great. As a chiropractor, I see many patients with headaches. From a point of view of a neurologist, do neck problems contribute to headaches?
Absolutely. That's why I'm happy to be on your show, because I'm sure you see many people with headaches, and definitely neck contributes to headache because it's connected, right? The neck is connected to your head. So very common scenario. People sit at their desks now typing all day long, and the neck gets stiff and they get into muscle spasm, and that triggers a migraine or another kind of headache. It can trigger migraine, tension headaches. So neck is extremely important. And often if you don't take care of your neck, headaches don't go away. They can do everything right and
Yep.
exercise and eat right.
Right.
Nothing works until your neck muscles get
Yeah,
stronger.
stronger, relaxed.
Yeah.
You know, it just changes
Yeah.
the whole game.
And patients go to chiropractor. I tell them a sign of a good chiropractor, I'm sure just like you,
Yes.
is the one who gives you exercises to do. Doesn't just manipulate, but actually wants you to strengthen the muscles.
Exactly.
So
Right. That's how we approach it for sure. Yep. You've published tons of articles and book chapters on the role of magnesium for headaches.
Yes.
And tell the listeners out there about your research on magnesium. Okay, please.
Yeah, so magnesium was a surprise to me as well. A professor of physiology at the medical school where I teach came to me and said, I'd like to look at migraines and magnesium. I said, I never heard of it.
Right.
It was 20 years ago, actually.
Yeah, sure.
So when we started doing research, and shockingly, half of the people with migraines are deficient.
Mm-hmm.
And the reason he was the first one to think about it is because magnesium was suspected for a long time to be a problem in migraines and other diseases, but nobody could measure it accurately. So he developed a very accurate test.
Mm-hmm.
Regular blood test that people order in a laboratory does not tell you anything.
Go for your normal physical. You're not going to get that.
Not going to get
test.
it because most of your magnesium is hidden inside the cells.
Right.
So if you do a regular serum magnesium, it could be normal, but you're still deficient.
Uh-huh.
So we ordered a test called RBC magnesium.
Okay.
Or more often, I just go by clinical symptoms.
Yes. Right. And then the magnesium comes into play.
Yes, that's right.
Okay. So I know you've developed a patented over-the-counter medicine
Yes.
For headaches that is sold at CVS, I think Walmart's, if I'm not mistaken. Please tell listeners about it. It's a great product.
Finding out about magnesium, I've discovered that magnesium is low in many people with different kinds of headaches. Taking just plain magnesium often doesn't do it because it absorbs very slowly. So magnesium is a good supplement. And I tell all my patients to take a magnesium daily.
Mm-hmm.
Sometimes we give even intravenous injections on a monthly basis because people don't absorb oral magnesium.
Mm-hmm.
So magnesium by itself wasn't going to do it, but I put together magnesium with aspirin.
Mm-hmm.
And magnesium is very alkaline and aspirin is very acidic. That's why it upsets your stomach.
Yes.
But if you put magnesium, it becomes protective of your stomach.
Oh.
Not only that, it improves absorption of aspirin, and aspirin improves absorption of magnesium.
Right.
So they're complementary. But most importantly, unlike any other form of aspirin, it actually has magnesium that buffers the acidity of the aspirin and protects your stomach. So it's less upsetting to your stomach. It works very quickly too.
Yeah.
It's called Migralex. CVS sells it, but not Walgreens yet.
Oh, okay.
We're
I'm
working
sorry.
on
I
Walgreens.
thought of it.
And
Okay.
Amazon.com, obviously.
Yeah,
it's
yeah.
over-the-counter medicine.
Okay. And how long has that been around?
It's been a couple of years.
Uh-huh.
We are trying to build up sales, but I'm doing it all out of my own pocket, so I don't have any big companies behind me, any investors. I just do it because I'm very passionate about this, and people who try it really like it.
Well, which is great too. I mean, as a neurologist, you're in the medical world, and you're going on the alternative side, you know, and less side reactions, et cetera, et cetera.
True.
So,
alternative medicine has been always an interest of mine.
Yeah. Mm-hmm.
Since my residency years, which is now 30 years, I became a certified acupuncturist.
Okay.
So I also do acupuncture. And I've conducted some trials of herbal medicines for headaches, like butterbur.
Right.
One of the largest studies that we conducted was butterbur for migraines.
Mm-hmm.
And it was effective, actually. There are issues with butterbur, but many other herbal supplements that we recommend as well.
One of the ones I'm somewhat familiar with is feverfew.
Yes, feverfew is
that another?
Yes, correct.
Now, can you use those? This is off topic a little bit. In conjunction with the magnesium,
Of
aspirin.
course. Yeah.
There's no reactions.
No. There are actually products that combine magnesium, feverfew, and the vitamin B2. Or other vitamins together in one pill, so it makes it more convenient.
Right.
But feverfew, you mentioned, is extremely safe. It's been around for 100 years.
Yes.
It's an anti-inflammatory herb.
Yes.
So it's a very good one to recommend. And another one I like, you probably also recommend it, is Boswellia.
Yes, all the time.
Boswellia is great. Now, butterbur, I mentioned, has a couple of issues. Butterbur, if you take a plant, unlike feverfew and Boswellia, you can eat raw, like a salad. Butterbur is toxic. It has to be very purified product, and German product that's available on the market is very purified, but even that is not allowed in Germany. So butterbur is something I want your viewers to be careful about.
Okay, right.
No problem with feverfew or Boswellia, though.
It's great. Okay, so you know what, Doc? Let's talk about your research projects. Let's talk about some of those. Tell the viewers a bit about your projects that you've been working on.
Well, now we're doing a very, very unique project, and we are trying to use stem cells.
Right.
Which is the buzzword. stem cells have been in research for 20 years, and still we don't have any approved products yet. And the FDA really strictly regulates what you can do, what you cannot. So what we decided to do, and it's not my original idea, there's a publication from Australia where 4 people were treated this way and the headaches went away. So we're taking people for whom nothing worked.
Yes.
We don't start with that. You have to try several drugs and Botox injections, which we do for migraine. If all that fails, then we will enroll you in the study. We have now 9 patients in the trial where we take your stem cells from your fat. Fat is the richest source of stem cells in the body, surprisingly.
Right,
It's not the bone marrow, it's the fat.
Yep.
So we have a plastic surgeon at Cornell who does the liposuction. We separate cells and then inject, just like Botox.
Interesting, yeah.
And preliminary results encouraging, but it's not a magical cure because, again, we are taking the worst cases where nothing works.
Correct.
But
right.
even
Magic.
among those, there is some improvement.
Yeah, well, that's encouraging for sure. Yeah.
Yeah.
Okay, so are there any new promising treatments for migraines on the horizon?
Oh, yes.
On that?
Yes.
Let's talk
Well,
about
it's pharmaceutical companies. There are 4 of them developing a totally brand new class of medications. Now, we have the old drugs, which are very effective, called triptans, like sumatriptan or Imitrex. It's a prescription medicine.
Right.
Well, in Europe, it's not a prescription medicine anymore. But here there's sumatriptan, Imitrex, Maxalzomig. They work on serotonin receptors in your brain and stop migraine very, very effectively in about 60 to 70% of people. So there is still 30, 40% of people for whom it doesn't work. So this new category of drugs attacking CGRP, which stands for calcitonin gene-related peptide, and it appears to be extremely effective as a vaccine. It's not a pill you take. You get a shot once a month, no more headaches.
Wow.
So all 4 companies are now in phase 3 trials, which is the last phase before it gets approved by the FDA. Again, looks very promising, but it could be another 2-3 years before we have it available.
Takes a long time for
Yeah,
all that.
yeah.
Sure, for sure. Okay, so you published 3 books on headaches.
Yes. Here's
One
one
for
of them.
doctors?
Well, no, 2 for 2 for
2
consumers,
for Joma, right?
and 1 for the doctors.
Right.
This one is What Your Doctor May Not Tell You About Migraines.
Okay.
It's a series of books, What Your Doctor May Not Tell You About different conditions.
Yes.
So this is specific on migraines. And
Great.
again, the focus here is non-drug approaches.
Great.
Things like
Right.
magnesium and
I mean, you don't want to be
feverfew and
going
other
over and
things.
taking over-the-counter medication if you don't have to, right?
Right,
I mean,
right.
this is what's going to
Yeah.
give you a lot of different options.
Yes, so that's still available
Where can that be got?
on Amazon and
Great. And
bookstores
it's
as
called
well.
what-
Your Doctor May Not Tell You About Migraines.
That's awesome. Great.
Yeah,
Okay.
it's a good book.
Yep.
And by the way, this is to show you another product I brought.
Yep.
This is the Migralex medication that you can find at CVS stores and
Right,
some
right.
other private pharmacies as well.
Okay. That's a great product. Again, for headaches, always trying to get away from the medication for some, if we can. Why always go the
People-
other way?
Exactly. People who hate taking prescription drugs. So
Yep.
this one is non-prescription, so it's a little milder than prescription
Right.
drugs. But even that, I tell the patients, the goal is not to take medicine. The goal is prevention.
Correct.
And things like regular exercise and meditation and supplements is much better way to go.
For sure. Okay. So besides magnesium, of course, chiropractic. All right.
Yeah.
What other alternative treatments do you recommend?
Right, so I just mentioned we have scientific proof that exercise actually prevents migraines. Not just good for you, I'm sure you tell all your patients to exercise.
Always. Yes.
But we have a study out of Sweden looking at 46,000 people, and they have everyone in the computer database. That's why they can do amazing studies. They just plug in some numbers, and the computer spits out the results. In 46,000 people, the more you exercise, the fewer headaches you got. Very strong correlation.
For all headaches, or we're talking
All headaches.
migraine
All
only?
headaches.
All headaches.
All headaches.
Good.
So exercise number 1. Neck, you mentioned that.
Right.
I tell them if you don't have time to go to see you or another
Right.
chiropractor, you do isometric exercise. I'm sure you tell
Right.
people,
For sure.
strengthening your neck muscle.
Yes.
Then meditation has been in the news a lot lately, and I have a blog on nyheadache.com/blog really reporting amazing results from scientific studies published in serious neurological journals and psychiatry journals. And they have actual images of your brain that shows the changes in your brain, structural changes in your brain from meditation. You would think meditation, yes, it's relaxing, it feels good, but actually it changes the way your brain looks.
Sure.
When you have chronic pain, certain parts of the brain atrophy, thin, becomes thinner, and after meditation they go back. They increase in size. So meditation is something I also recommend to all of my patients.
Yeah, I love that as well. That
Yeah.
yoga, meditation, acupuncture. You said
Yeah,
you're an
acupuncture is
acupuncturist.
great too.
Also works as well.
Yeah, so we have a long list of non-drug approaches.
Right.
And I usually write it out for patients because they forget. You tell them so much stuff they don't remember. So I write it out. Stay away from caffeine is another one.
Yeah.
Another big for headaches. Caffeine is a double-edged sword, and that's why the Migralex does not have caffeine, because a little caffeine helps, and Excedrin and Fiorinol prescription drug has caffeine, but if you consume caffeine on a regular basis, 3-4 cups a day of coffee, you are guaranteed to give you headaches.
Yeah, I mean, I often hear, I'm sure you do all the time, a patient will walk in and say, Doc, you know, if I don't have a cup of coffee in the morning, I get a headache.
That's right.
I mean, it doesn't take long for that whole effect to...
Yeah,
right?
and they don't associate it, but you tell them, stop caffeine. Well, it gets so much worse. Yeah, it's true. Withdrawal, it can be difficult. But once you're through withdrawal, after a few days, you feel much better. And don't wake up with a headache.
Right. Let's talk about the magnesium, a couple extra questions here, okay?
Sure.
So, if you take too much magnesium, can it be toxic to your body?
Yes, if you have kidney disease.
Okay.
That's the only time.
Right.
Fortunately, it's extremely safe. If you take too much in the pill form, you're going to get diarrhea.
Okay.
And often some people actually get diarrhea even from normal, regular strength magnesium. And then we try different magnesium salts. There's magnesium oxide and glycinate and aspartate and gluconate, many other forms. So you try one, try the other. If all upset your stomach, then we give monthly infusions. But as far as taking too much in the pill form, it's very difficult because you get diarrhea first before you get too much into your body.
Right.
Again, unless you have serious kidney problems.
Right.
Then you can overdose very easily.
Okay. Talk a little bit, if you would, about the injection of magnesium.
Right.
So a patient would come for that when?
Usually, once we establish that they're deficient, and two ways we do that. One is send them for a blood test of this RBC magnesium, a very sensitive test. Or if a patient comes in and has other symptoms of magnesium deficiency, and those are cold hands and feet, or feeling cold. I sometimes know the patient has deficiency in magnesium when they go through the door because in the summer they're wearing a sweater, air conditioning is bothering them.
Yes.
Or if they shake their hand and their hand is freezing.
Yeah.
Or if they complain of muscle cramps, you see that a lot too, leg cramps, foot cramps, women PMS symptoms before periods. All these are signs of magnesium deficiency. So if a patient has 3 or 4 of these, I tell them, we don't need to do a blood test. You can start taking pills, or if the patient is suffering from frequent headaches, I tell them, let's do a shot of magnesium. It takes 5 minutes, no side effects, makes you feel warm, and immediate results.
Yeah.
And if it works, you start taking pills, and if pills don't work once a month, they come once a month for an infusion. Women often come before their period. Or they come once every 3 weeks even. It's, again, harmless and can give you immediate relief when pills do not get absorbed.
Yeah, and as one of my patients recommended you so highly for those injections, that's exactly why we're sitting here.
Yeah.
And she said, I've never felt so good, and she was a professional. And,
yeah, it's amazing. It's not just migraine patients who are deficient. General population, about 15% of people are deficient in magnesium. So multivitamins usually have only 100 milligrams.
Yes.
The daily recommended allowance for an adult is about 400 milligrams.
Right. Okay.
So that's what people should be taking.
And so people will say to you, and they say to me, well, Doc, what if can I get it from my food? I mean,
That's
talk
right.
about that a little bit.
Right. So if the food normally for a healthy person should have enough magnesium and every other vitamin and mineral. Right. Unfortunately, we eat processed food, which has less vitamins and less magnesium. Magnesium is in the usual suspects, whole grains, dark leafy vegetables. Right. So healthy diets have magnesium, but many people don't have enough magnesium for several reasons. One reason is genetics. Some people, we have actually families, grandmother, mother, child, all deficient because they are not able to absorb magnesium even if they take a lot of it by mouth. Right. Just the stomach doesn't get absorbed. The second genetic abnormality is kidneys lose magnesium very quickly. Okay. So that's one. But the biggest reason why regular diet will not be enough is because the major depleter of magnesium is stress. Okay. And alcohol and caffeine, but stress, we know, everyone knows that stress gives you headaches. How does it do it? Well, stress even can give you a heart attack. Yeah. So the theory is that when you have stress, adrenaline is released, and that makes magnesium go out from the cells, and you pee it out. So you acutely lose magnesium from stress. And that's why we think some people get a heart attack when they have perfectly normal heart. Yes. Because magnesium leaves the body and blood vessels go into spasm from lack of magnesium. Right. And then they look at the person, they're perfectly healthy. But major stress can cause, obviously, migraine headaches, muscle cramps, but also serious conditions. So magnesium is very important.
Very important. How about its relationship to calcium, vitamin D?
Yeah, good question.
Which is super
everyone's deficient in vitamin D.
now.
Yes. We have studies showing that even dementia, Alzheimer's disease, people with Alzheimer's have low D levels. So D is very important. And you have to have D not just in the bottom of normal range, because normal range is on the blood test 30 to 100.
Yes.
They've shown studies that in neurological conditions, if you have a bottom quarter of your normal range, you're going to be much worse than if you have a top quarter. So it's not just enough to have 32, 35. You should aim for 40s, 50s of your vitamin D level when the doctor checks. So if the doctor tells you, oh, your D is normal, ask for a number.
Yeah.
What's my number? If it's 35, 37, 32, it's not enough, even though it's considered normal.
Right.
Calcium, on the other hand, separate issue. Calcium and magnesium are natural antagonists. So very often you can find in the vitamin store CalMag, which is calcium-magnesium combination.
Correct.
Which is very good for your bones because magnesium helps calcium absorb better. But magnesium does not get in with calcium. So they are like push each other away. So magnesium pushes calcium into your body, magnesium leaves. So if patients tell me I need my calcium, so fine, take your calcium or calcium magnesium one meal and take pure magnesium without calcium at a different meal.
That's a great tip. And how about the vitamin D? Where would that come into play?
D could be any time.
Could be any time.
Could be any time, usually with food.
Okay, great. Another question about some people need to be on specific medications for their heart, diabetes. Does magnesium interrupt or interact with those other drugs?
Again, another excellent question, because there's one drug particularly called Neurontin or gabapentin, often used for pain and headaches, and was originally an epilepsy drug, but not much of it is used for epilepsy. But magnesium interferes with absorption of gabapentin. So it's not dangerous, but you're not going to get your medicine into your body. So certain drugs you have to take without magnesium. That's mostly gabapentin and a few others, but otherwise it's not a big issue.
Okay. Well, great. Anything else you want to add, Doc, before we wind up here?
Well, there are lots of alternative therapies out there, and one of the supplements I recommend, we didn't mention yet, is coenzyme Q10. I'm sure you know it because it's good for muscles, but specifically for migraines, there was a study done of 1,550 adolescents.
Yes.
1/3 of them were deficient in CoQ10, and if you give them a supplement, headaches go away.
Yeah.
So you have a 35% chance of having CoQ10 deficiency. So it's another good supplement to consider.
So if somebody comes into you with headaches, I mean, and you just say, well, take me through, just before we end here, a visit to your office. I walk in your office, Doc, I've been having headaches for years. Nothing has helped me. Tell me what. So
before you come in, though, you fill out the questionnaire, 10 pages, because it makes it more efficient. People can sit and think about the answers and figure out the numbers and medication they've tried. So that's very important, detailed history in any medical condition. And so we try to find the triggers, family history, stress, lack of sleep disorders we didn't mention. People have restless leg syndrome, 5% of the population, that they constantly jiggle their legs and they move. The worst part about this condition, when you're sleeping, you're still moving and you're not getting a refreshing sleep, and you get more headaches. So sleep disorders is something we look at. So it's really an involved process: diet, sleep, lifestyle, lots of things to try to figure out what's causing the headaches.
Before you give them a medicine,
That's right.
Course. I mean, I know you, and it's the last thing you're going to say.
Correct.
Medication.
Yeah, that's the last. Luckily, we often can avoid medication altogether.
Yeah. Okay. So
unfortunately, American medicine is like quick fix. Give me a pill. Don't have time. Yeah, 5 minutes in and out. Here's a pill. And the doctor's often obliged because they have 5 minutes to see a patient.
Yeah. Well, the whole system has changed, and we know that.
Yeah.
All right. Okay. So the doc's book is What Your Doctor May Not Tell You About Migraine Headaches. Great book. A lot of research done to get to that point. Migraine, his product, which is absolutely fabulous. And I'd like to thank the doc for being on the show. Dr.
Thank you
Mauskop,
for having me.
It's been a pleasure. And hope
mine.
to see you again. Okay.
Thank you.
And thank you for being so attentive. And we'll see you on the next show.